I'd like to welcome all of you here to this lecture on what are the recent advances in the management of children on the autism spectrum, children having cerebral palsy, and other neurodevelopmental disorders. I'm Dr. Alok Sharma. I'm a neurosurgeon, director of the Neurogen Brain and Spine Institute, which is in Mumbai, India, as well as professor and head of Department of Neurosurgery at the LTMG Hospital and Medical College. I have a special interest in regenerative medicine, which focuses in children on recovery from autism, cerebral palsy, intellectual disability, and in adults from paralysis that follows spinal cord injury, brain stroke, motor neuron disease, and other conditions. Why are we all here? We are all here because all of us have special needs children. Children on the autism spectrum and cerebral palsy, intellectual disability, and what has happened is that we've been looking for solutions. We've been looking and looking and looking. We've been trying to find answers. What is it that can help our children? But what has happened so far? What has happened so far is you've gone from pillar to post. You've gone to doctors, hospitals, and clinics, and therapists, and rehabilitation centers. And what have you been told? There is no cure, there is no medical treatment, and that the only thing available is rehabilitation therapy. And I'm here today to tell you that that is no more true. That innovation, research in medical sciences, regenerative medicine, has finally found a scientific treatment that can help our children. So what is it that's new in this field? The old thinking over 150 years of medicine was that once the nervous system or the brain is damaged, no regeneration is possible. But the new thinking is that some amount of regeneration is possible by cellular replacement and repair. This is the new thinking. So the older view was the only thing that's available for our special needs children is rehabilitation. But now there is in addition a new therapy, an exciting new innovation in medicine called stem cell therapy, along with a whole group of therapies called integrative therapies. And together, these can reverse children on the autism spectrum and can help our children with cerebral palsy and other neurodevelopmental disorders get back to a functionally independent life. So this is what is new. Earlier it was only rehab, and now it is rehab along with stem cell therapy and integrative therapy. It is this combination that can give a complete new life to our children with special needs. So on this X-ray on the left hand side, you actually see a fracture of the leg. This is a broken bone in the leg. And I ask you a simple question. If any of us were to have a fracture of the leg, would we do rehabilitation? Would we do physiotherapy on a broken leg? We would not, right? What we would do is we would go to an orthopedic surgeon who would fix it with plates, screws, and a plaster, and then we would do rehabilitation. But what are we doing with our special needs children? This is a scan of a child with autism where the blue area is damaged. Okay, you can see this blue which is damaged. We are giving rehabilitation on a damaged brain. This is exactly like giving physiotherapy on a fractured leg without repairing it. Now what if this damage could be repaired? Like you see here, this is green, this is normal functioning brain. The brain is repaired. What if we did rehabilitation on this? Wouldn't we get better results? And here's the good news. This regeneration is possible using a combination of stem cells and integrative therapy. So let us now focus on how can we repair this through simple, safe, and effective treatments. So I'm here basically to shift all of us from a state of hopelessness to one of hope. So I'm going to talk in this talk on three topics: on what is stem cell therapy. I'm going to briefly talk about various rehabilitations, and then I'm going to talk about integrative therapies. So there are three parts of this talk. So what exactly are stem cells? The word stem comes from the stem of a tree, and just like the stem of a tree gives rise to branches and leaves, fruits, etc. There are some cells which can lead to any, which can form any cells of the body. A cell which can become a nerve cell, a blood cell, a brain cell. So a cell which can become any cell of the body, that cell is called a stem cell, and the word stem cell comes from the stem of a plant. So stem cells have some special qualities. One is that they are able to multiply. So if you have a single stem cell, you can make them into multiple stem cells. Second, and this is the most important property, is that they convert. So if you have a single stem cell, you can make it into a brain cell, a heart cell, a muscle cell, or any cell. So this is the most important property of stem cells, that they can convert into any cell type of the body. Third is that they release certain positive chemicals in the body. These are called growth factors that help in the repair process. And finally, they improve the blood supply to the brain. So this combination, the ability to multiply, the ability to convert into any cell type, the ability to release positive factors that help in healing, and the ability to get new fresh blood towards damaged tissue, this combination results in an ability of the stem cells to repair, to regenerate, and to replace damaged tissue. So that is the exciting potential of stem cells, that they can repair, regenerate, and replace damaged tissue. So basically, stem cell therapy involves the use of healthy cells to replace damaged cells. So as you can see here, these are, this is the blue is the damaged part of the brain. If we give stem cells, we can repair the damage. So that's what this is about. Now there are different types of stem cells. You can have stem cells taken from our own body, which are called allogenic. So when you take from our body and put it back into our body, these are called autologous. Then you have cells which you take from someone outside and put it into you. That is called allogenic. So there's autologous, taken from the same patient, put it back. Taken from the same child, put it back in the child. And one taken from outside. There are also different types of stem cells. So you can get stem cells from the embryo. Like, when life starts, when the father's sperm and mother's egg comes together, that 1 becomes 2, 2 becomes 4, 8, and it keeps multiplying. And on a 5th day of life, we were a bundle of grape-like cells in our body. This was a bundle of stem cells, which means all of us, on a 4th or 5th day of life, we were a bunch of stem cells. And from those stem cells, the whole body was formed. Our bodies, everybody's bodies, which means stem cells have the potential to be able to form all tissues of the body, because the entire body was made from this bundle of stem cells. So if these are taken out, and these can be used therapeutically, however, there are several ethical issues about the use of embryo. There are also several potential dangers in the use of embryonic stem cells. So I wish to state categorically that we do not use embryonic stem cells for the medical risks that are involved and for the ethical issues. You can also get stem cells from the umbilical cord. This is the cord that connects the mother at birth, mother and baby at birth. And this contains stem cells. So nowadays at birth they are actually saving this. Normally the umbilical cord is thrown away in garbage, but if it has been saved, you can potentially use those cells. We are not using this either. We are using what is called adult stem cells. They are called adult, but they occur in children too. This is in our bodies. So in all our bodies, especially inside the bone, there's a liquid inside the bone called bone marrow, which is rich with stem cells. So these are called adult stem cells. So this is what we use. And the last type, induced pluripotent, is a combination of adult and embryonic, and we are not using this right now. This is not available for clinical use. So everything I'm going to talk about is adult stem cells. I repeat, we do not use embryonic stem cells. So we work with adult stem cells because first they're very safe, they don't become tumors, they don't get rejected because they are from your own body. It's very easy to get them by a single needle prick, and there are no ethical issues because you're using your own cells for yourself. We are taking cells from our child and putting it back in our child, nothing from the outside. Now there are different ways of putting it back. So the way that we use is we inject it with a needle into the fluid in the lumbar spine, and this fluid is called cerebrospinal fluid. When we inject it here, it goes straight into the brain. So just a needle prick, simple needle prick. You can also inject it intravenously or intraarterially into the muscles, through the nose or directly in the brain. There are different ways in which stem cells are put. The highest recognition in the field of medicine is the Nobel Prize. And 3 times over a period of 15 years, the Nobel Prize in medicine has gone to stem cell work in 1990, 2007 and 2012. And the stem cells that we are using from bone marrow, well, that got the Nobel Prize way back in 1990. All right, so 3 times. There are very few fields of medicine where the Nobel Prize has been given to the same field in such a short interval. So what's the scientific basis of the work that we do? So all our work is published in peer-reviewed journals. We have 107 scientific papers, 16 on autism, 15 on cerebral palsy, 18 on muscular dystrophy, etc. What is the importance of this? See, when we publish something in a medical journal, it gets what is called peer-reviewed. Peer review means somebody outside of us has studied our data, evaluated it, the editor, the editorial board, and 3 independent reviewers review the work. They authenticate its scientific value and its ethical content, and only then they permit its publication. So when something is peer reviewed, it means somebody outside of the person doing the work has validated that data. So we don't have 1 or 2, we have over 100 scientific papers. And this is very important. So wherever you go, whenever you seek a new treatment or a treatment like stem cell therapy, it is important to ask the treating doctors or the treating hospital whether their work is published in scientific journals. If it is, then it has been validated. Apart from 107 papers, we also have published chapters in textbooks. So you can see this book published by the SMG group on recent advances in autism. Now, they have introduced a chapter in their recent edition, Stem Cell Therapy in Autism, and they asked us to write it. So this chapter has been written by us in this book on autism. In this textbook on cerebral palsy by NTech, it's a European publication, again they have a chapter, Stem Cell Therapy in Autism, in cerebral palsy, and this again has been written by us. In this chapter, in this book on physical disabilities, therapeutic implications, there is a chapter on stem cell therapy in pediatric neurological disabilities. This also has been written by us. In this book on muscular dystrophy published by Avid Science, there is a chapter, Stem Cell Therapy as a Therapeutic Modality in Muscular Dystrophy. Again, this chapter is written by us. So not only do we have scientific papers, we have chapters published in medical textbooks, okay, on stem cell therapy. I'm also very fortunate, since we are talking about books, that in a book which I have published and translated into a regional Indian language, the Honorable Prime Minister of India, the current Prime Minister Shri Narendra Modi, has actually written an introduction. You can see this is the introduction written by him, and that is myself with the Honorable Prime Minister, where I was presenting him a copy of the book for which he wrote an introduction. Since we are talking about Honorable Prime Minister, I'd like to add that he takes a very special interest in stem cell therapy. And when he went to Japan, he took time off from, the busy schedule a head of a country would have, and went to the laboratory of Professor Yamanaka. Professor Yamanaka got the Nobel Prize for his work on stem cells, and he actually took time to go to his laboratory to meet with him and understand his work. In India as well, there you can see him with Professor Yamanaka. In India also, whenever he gets an opportunity, this is him with the Stem Cell Therapy Center in Bangalore, a city in India. And he in fact gave a very intense speech in the Indian Parliament on stem cells.
मैं जापान गया, तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट यामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या। हम गए तो वहां गए, उनसे चर्चा की, और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So this is very interesting. The Prime Minister of India talking in the Indian Parliament about stem cells. Now, when prime ministers and presidents talk about a subject, it is obviously something of great public interest and of great public value. So let's look at how this treatment is done. How do we do this treatment? So what we do is there is a 3-step way of treating this. The first is that we put in a needle into the bone of the pelvis, which is just above the hip bone. So you can see this is the hip bone, and this is the pelvic bone, and this needle is put here, and then we aspirate the liquid inside the bone, which is called bone marrow. This takes about 15 minutes. The child is given sedation, so the child is sleeping, and we give local anesthesia, so the child has no pain. Once we've taken this out, we take this bone marrow to our laboratory, where we separate the stem cells from the bone marrow. And once we separate the stem cells from the bone marrow, we then inject it through a very thin needle into the fluid in the lumbar spine. So the whole treatment has got just 2 needle pricks. With one needle we take out, and with one needle we put back. Now let's just watch a video of that. Here you can see the bone marrow coming out. This is in the laboratory. We separate the stem cells. And here with a very thin needle, you can see that we are injecting it into the lower back. I just like to see this once again. You can see the bone marrow aspiration, the bone marrow taken to the laboratory, the stem cells are separated, and through a very thin needle, you can see this, it's a very thin needle. This needle is thinner than the needle with which we collect blood for blood investigation, and we are injecting it into the lumbar. So I wish to reiterate this. The whole treatment involves 2 needle pricks. One we aspirate and one we put back. There is no surgery, there is no operation, there is no cutting, there is no stitching, there is no post-op intensive care, there are no wires, tubes and monitoring. 2 needle pricks. And what are we putting back in the child? The child's own cells. There is nothing from the outside. There is no artificial chemicals or agents. This is natural healing, the way the body has been designed to heal. We are just taking good healthy cells from the bone marrow and putting it to repair the damage in the brain. So now let's look at autism. All of you are of course aware of what autism is. It was described in 1943 by Dr. Canham, and it typically appears, the diagnosis is made in the first 3 years of life, when the parents notice, as you all have, that your child is not talking, there are behavioral issues, there isn't eye contact and things like that. It is now referred to as a spectrum disorder, where it could be mild, moderate or severe, and boys have it 4 times more than girls. The incidence of autism is increasing phenomenally. In 2004, 1 out of 166 children had autism. In 2020, it had become 1 in 54. That is a 3-time increase in a 15-year period. And this is going on and on increasing. This is an epidemic that hasn't got the importance or attention it deserves. 1 out of every 50 children born is having autism today, which means there are 70 million people with autism on the planet. That is 1% of the world's population. 1% of the world's population has autism. This is something which has not got the public attention it deserves. And so autism is something, it's a public health issue. The main symptoms are a combination of impaired communication, a poor social interaction, and various repetitive behaviors. So what is new? What is new is our understanding. For the first time today, we actually understand what is happening in the brains of our children with autism, which parts of the brain are not functioning properly, and why. And this understanding is now helping to get us newer treatments. And the second is the availability of stem cell therapy for autism. These 2 new things have transformed the world for our children on the spectrum. So here you can see in this scan, this is what called a PET CT scan. This is a functional study. This is a study that shows us how much the brain is functioning. And in this, you can see that there is what you see here, blue in color. These are areas of the brain that are what are called hypometabolic. That means they are functioning less than what they should. This is brain which is less active, less energetic, less functioning. And when you compare these areas of the brain to the problems in the children, there is a complete match, because in the brain, every area has got a fixed role. There's an area for speech. There are different areas for everything else. So you can actually see in each child, the part of the brain which is functioning less corresponds to the symptoms. So now we actually know, for the first time in all these years, which parts of the brain in our children with autism are functioning less. And this work of ours has been published in a journal, the World Journal of Nuclear Medicine. We have actually shown, we are among the first people to actually show exactly what is happening in the brains of these children, what's happening in the brain. And this is useful, because once you know what the problem and where the problem is, now you can fix it. All this while we weren't even clear, because these children weren't being investigated to the extent they should have. A diagnosis was made and the child was sent for rehab. No, now it's important that we investigate, we look into their brains, understand what the problem is, and then try to fix it. So the management of autism over the last 10 years has become multidisciplinary. We must remember that there is no single silver bullet for autism. It's a combination of treatments. Like I said in the very beginning, rehabilitation is the single most important tool, but rehabilitation should be done on a brain that is repaired, not a brain that is damaged. So that's the role of stem cells. And when we combine that with integrative therapy, now you have the perfect combination to get our children back into living independent lives. So there are all these therapies, and we are going to look at some aspects of rehabilitation. So I told you I'm going to talk about three things: stem cells, neuro rehab, and integrative therapy. I've spoken to you about stem cells. Later on I'm going to talk to you about the results of stem cells, but I just explained to you what they are. Now very briefly, I'm going to go through this fast because all of us know about rehab, but I'm mentioning this here to emphasize the importance. After stem cell therapy, rehabilitation becomes even more important. The brain is like a computer. A computer's got hardware and a computer's got software. All right. Now, if you see those scans before, that blue area, that is defective hardware. And what stem cells does is it fixes the hardware. But stem cells can't put in software. Software will come from rehabilitation. Software will come from what the child is exposed to at home. Okay, so that is why rehabilitation is extremely important. So among the important aspects, I'm going to run through this fast, I won't explain this, is ABA, which is very important because these children have a lot of behavioral issues, and ABA helps to correct the behavioral issues. This is behavioral therapy happening at our institute. Occupational therapy has an extremely important role to play, and occupational therapy has got different components. There is activities of daily living, there is play therapy and cognitive behavior therapy and vocational rehab and all of that. So OT has an extremely important role to play along with ABA, and that is occupational therapy happening at our institute. Then sensory integration again is a very, very important part. It's a part of occupational therapy, but since a lot of our children have sensory issues, focused sensory integration therapy is very important, and that's the sensory integration room at our institute. Speech therapy is extremely important because the majority of children with autism have speech issues, and that's speech therapy happening at our institute. Now physiotherapy, now this I want to emphasize a little. It is normally believed that children with autism don't need physiotherapy because it apparently physically they're okay, but what we have found is that they actually do have physical issues. There are problems with their motor coordination, there is certain clumsiness, there are gait issues, postural and joint issues. So there is a role in at least some of the children for a physiotherapy program as well. So that's physiotherapy happening at our institute. Aquatic therapy is extremely useful, and this I must emphasize, this is not being done enough. See, aquatic therapy is not swimming. People think aquatic therapy is swimming. No. Aquatic therapy is rehabilitation in water, and we found tremendous benefit of aquatic therapy, particularly with certain sensory issues, cognitive issues, attention, sleep improves dramatically, hyperactivity gets reduced, and stimulatory behaviors, etc., get reduced. So this is aquatic therapy. We have a dedicated aquatic therapy section where this therapy and this is happening at our institute. Then there are various art-based therapies. This is again music therapy happening at our institute. So all these therapies are there, and they are all very useful, and they are all required even after stem cells. Okay, so we must understand that it's important. Stem cells does not mean the end of rehabilitation. It means better results from rehabilitation. Then there are a whole lot of supplementary therapies, which I'm sure most of you parents have tried. There's, many of our kids have heavy metals, so there is chelation, there is TRS detox. I'm sure all of you have tried supplements from vitamin B6, vitamin C, omega-3, DMG, inulin, etc. And all of these have a usefulness. All these supplements have their own usefulness, and they may or may not be continued when you combine with stem cell therapy, but they're all useful, and we recommend that they all be continued. Diet has an extremely important role to play. We are all aware of that. There are certain foods that should not be given, and there are certain foods that are preferentially to be given. So probiotics, prebiotics, ketogenic diet, gluten and casein-free diet, vitamin-rich food, camel milk. There's a lot of work that is done on camel milk, curcumin, etc. Foods to avoid obviously are sugars, foods with additives, pesticides, and hard to digest starches. Ketogenic diet, which is high in fat, enough proteins and low carbohydrates, plays a very important role in autism as well. So let's say we only do rehab and supplementation. What are we doing? We are doing it on this brain. What if we did it on a repaired brain? And this repair happens with stem cells. So what if all these therapies we did on a repaired brain instead of a damaged brain? So these are our results. These are, we have now so far actually treated over 3,500 children with autism. This is the data from 700 patients, because the data is published after a long follow-up. And you can see about 89% of the children have shown significant improvements. 33% have shown a significant improvement. That means they are no more on the autism spectrum. I'm going to repeat that. 33% of our children who came to us with mild, moderate, or severe autism are no more on the spectrum. That means they are not going to special schools, they are going to normal schools. They are going to college. They are able to speak. Okay, they are able to live independent lives. Their behavioral issues have been resolved. That's 33% of our kids. 29% of our kids have a moderate improvement. Moderate is when they are not off the spectrum, they are still in the spectrum, but they don't require special care. They more or less have independent lives. 25% of our kids have a mild improvement. That means some things have improved, but they still have some pending issues. And 10% of our kids do not improve. Now, when we analyze this data, we found that there's an age correlation. So we found that when the kids who are treated before puberty, that means before 10 or 11, they all were coming under the significant improvement. Those between 11 and 20 came in the mild to moderate, and those who were above 20 were the ones who did not show an improvement. So I'm going to repeat that. If we treat our children before puberty, puberty in boys and girls happens between 10 and 11. We are giving them a chance of a complete recovery. The longer we wait, the lesser is the recovery. Okay? And those who come to us after 20, we may not be able to help them. So that is why there is a certain importance of early intervention. The earlier we intervene, the better results we are going to get, and our data actually shows that. And this is the evidence, objective evidence. Now above are the brain scans done before the stem cells, and this is the same patient. You are seeing different sections. This is a horizontal, this is a vertical, and this is a side section. And the blue, the same. You can see the damage before. Now let's see 6 months after. You can see this damage is almost completely gone. This damage is almost completely gone. This damage is almost completely gone. So you can actually see objective evidence that the damage in the children with autism, damage as seen on the PET CT scans of the brain, can be reversed with stem cells. And I'm showing you one or two, but we have over 3,000, yes, over 3,000 scans before and after that show a resolution of the damage which is causing the symptoms of autism. So autism can be reversed. This is another scan to show you. Above you can see the damage, and below you can see that the damage has been resolved. Above is before stem cells and below is after stem cells. And then of course some people asked us, because we do the scans after 6 months, they said, how do we know down the years this damage doesn't come back? So in a couple of patients we did this year after year. Here you can see 2012, 13, 14, and you can see the damage is progressively gets better. Here you can see the blue, and you can see it's less, and here it's almost gone. So the improvement in the brain scans of kids with autism is persistent and sustained over the years. So the world's first scientific paper in a PubMed index journal was actually written by us. This is a paper in the journal Stem Cell International, and as you can see, it says autologous bone marrow mononuclear cell transplant, an open label proof of concept study. So we published the world's first paper. After us, there was been a paper from China, then there was a third paper from Italy, and the fourth and fifth papers have come from the Duke University in America. So, but now there are several papers. There are about 30 papers now from different parts of the world. So you can see from 3 different continents. There's a paper from India and China, there's a paper from Europe and Italy, and there's a paper from the United States, from 3 different continents. I'm showing you the first 5 scientific papers. So there is a science to what I'm talking. Not just that we are saying, doctors and innovators across the world are showing similar results to us. So that is what gives this new treatment the potential of hope. Apart from that, we have 16 other papers on, apart from the world's first paper, we have 16 other papers on stem cells and autism. Now, I've got short videos of patients from 5 different continents. Maybe I'll just show you 2 or 3 of them. These are kids who have shown improvement after stem cells, just to show you different spectrum from different continents, how they have improved. So let's look at these videos. This is a child of autism from Kentucky, United States. His father is a doctor, mother is a nurse.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about Neurogen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He's just so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. It's all the PET scan images. I can't tell you the word, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
So here is a child who did not have speech, who was in a special school, who is today not just going to a normal school, he is getting A+ grades. So that's the possibility of stem cells. The next short video is of children from Nairobi, Kenya. Now, all of you parents, I know how difficult and challenging it is to manage your child on the spectrum. That's one child. This is a story of a family who had triplets, 3 boys, all of them on the spectrum. This is their story about what their problems were and how the children improved with stem cells.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye, and no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far. Just with water.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he is taken to his bed. It takes a few minutes and he is asleep.
You see my sons cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So that's an amazing story of these triplets who have now started going to normal school. They've got their speech back, and almost all their behavioral issues are resolved. And the next film is, we saw a child from America, one from Africa, and we'll see one from Asia, that's from India. A child who had a lot of issues but now has improved so much that today this child takes tuitions. He's actually teaching, looking after special needs kids. A special needs child who has improved to the point that he now takes tuitions for special needs kids. Let's look at this amazing story.
Shantanu was my first child, so I was very excited about how he would be. But when I came to know that my child has a problem, it shocked me and I wondered, why did this happen only to me?
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on their feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier he was not able to fold even a handkerchief, but now he can easily fold blankets. He helps me in cutting vegetable and in cooking too. Goes to the market store for purchases. He passed his 10th grade. There have been improvements in many other aspects as well. For example, this emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions of other special kids.
So you know that he is now taking tuitions for children who are deaf, special needs children. That again is the magic of stem cells. So that was all about autism. We will now come to cerebral palsy. The word cerebral palsy, cerebral, which refers to the brain, and palsy means a problem in movement. There are different types of cerebral palsy depending on which part of the brain is damaged. So it could be one half of the body, just the lower limbs, the whole body, etc. So there are different types of cerebral palsy. There are some treatments available, there are medical treatments available, and there are some surgical treatments, but they all work on the symptoms. They don't resolve the fundamental problem in the brain. So let's look at the clinical results. This again, we've treated more than 3,000 patients of cerebral palsy. This is data from 660 with a 91% success rate. 20% of the kids had a significant improvement. That means they are now normal. 41% had a moderate improvement. That means they are now independent. They can take care of themselves. They still have some issues, but they are independent. 30% have a mild improvement. That means they are improved in some symptoms, but some remain, and 9% didn't improve. And this is a scan to show you that you can see on the left the blue is the damage in the brain, and on the right you can see after stem cells the damage is gone. Here again above you can see the blue is the damage in the brain, and below you can see it is significantly reduced. So this is objective evidence that even in the severe brain damage of cerebral palsy, stem cell therapy helps in resolving the damage. This is a paper that we have published. It wasn't the world's first paper. In autism we published the world's first paper. In cerebral palsy somebody had published before us, but this was among one of the earlier papers. And this is a clinical study of autologous bone marrow cells for cerebral palsy, a new frontier. Apart from that, we have another 15 scientific papers on cerebral palsy. So here is a small video of a child from Kenya. He was completely wheelchair, very spastic, quadriplegic, couldn't use his hands, couldn't stand, couldn't walk. And you can see after the treatment, he started using his hands. He's able to put on and remove his clothes, able to pack his bag, and do fine motor skills. See, earlier he couldn't even get off his wheelchair. Now not only can he stand, but he could open, take out a bottle of water and drink it. So these are the kind of improvements. And there you can see a wheelchair bound child who is now walking independently. So cerebral palsy too, there can be a lot of improvements. In intellectual disability, where the problem is mainly in cognitive abilities and adaptive skills, here again this is data from 247 patients, analysis of which shows 84% had an improvement. Again, 20% significant, 25% moderate, 39% mild, and 13% did not improve. Again, the world's first scientific paper on the role of stem cells in intellectual disability has been published by us in the journal Stem Cell Research and Therapy. And this scan shows you the objective improvements. You can see above the blue, and you can see after the stem cell treatment the blue is gone. And we have 5 other papers after the first paper, and here is the results of stem cell in this girl, and you can see the different changes which are there after the stem cells. You can see the improvement in writing and copying. She in fact now plays a musical instrument and is dancing. And won a prize at a cooking competition. So she won a second prize in this cooking competition. So a lot of improvements following stem cell therapy. And now the last condition that I will talk about is muscular dystrophy. Here is a condition where the muscles of the children gradually deteriorate, and here you can see at 5 years the gray is normal muscle. As you can see with the years the muscles keep on becoming less and less, and white is fatty tissue. So by about 16 to 20 years there is almost no muscle. You can see here at 5 years normal muscle, and at 21 years almost no muscle. And these are our results. This is data from 1,500 patients where we have an 85% success rate. The significant improvements are much smaller, just 4.5%, but 35% have moderate improvement. That means they become independent, 20% mild. 14% don't improve, but they become stable. But here's the important thing to remember. In this type of muscular dystrophy called Duchenne muscular dystrophy, all the children die by the time they are 25, all of them. There's a 100% mortality. So even remaining stable is important because we've actually saved their lives. And here is a comparative study that we did in patients who we treated with stem cells. You can see that they stabilized here in the above graph. And the patients who did not take stem cells, this is a comparison, they continue to deteriorate. So a big difference between the treated and untreated patients. And here's an MRI scan. You can see above there is white, there is no muscle, and after stem cell you can see that muscle is formed. This is an MRI of the thighs, of the legs. And this is an EMG which shows muscle contraction. You can see it is very feeble before the stem cells, and after the stem cells it is much stronger. and we have 18 scientific papers on this subject. And here's this child from America, from California, who when he came to us could barely crawl. He had not stood for 2 years before he came to us, and that was before. And now you can see after the stem cells, for the first time in 2 years, he actually stood on his legs, and from standing to slowly walking, you can see he's walking with a walker with a lot of support. Then slowly the support became less, and now you can see he's walking on a parallel bar. And there he is actually walking independently indoors and then walking independently outdoors. In fact, he had the opportunity to meet President Obama, Barack Obama, President of the United States. He went to the White House. The President wanted to hear all about his amazing improvements. So there he is, invited to meet President Obama at the White House to, share his improvements. So this is just a brief sense of what stem cells can do in autism, in cerebral palsy, intellectual disability, and muscular dystrophy. In adults, we treat patients who are paralyzed with spinal cord injury, those who are paraplegic, no movement in the legs, or quadriplegic, no movement in upper and lower limbs. We treat people who have a brain stroke, who are paralyzed on one side, and our spinal cord injury patients, they walk, they give up their wheelchairs, they've got walking. Our patients who are paralyzed on one side get back function of their hands. We treat a condition called motor neuron disease. It's also called ALS in America, where there is almost a 90% mortality in the earlier 5 to 10 years. And here we have shown a significant dramatic improvement in survival. So a large number of our patients are surviving way beyond that. So there are many other conditions, but because this talk is restricted to children and neurodevelopmental disorders, I will not talk about our adults. So a fundamental question that many of you may have in your mind is, how safe is this treatment? Right. As parents, your first question is, how safe is it? I mean, okay, we get results, but is there any risk involved? Here is the wonderful news. This is a completely safe treatment. We've now treated over 11,000 patients, and we've never had a major adverse event or a complication or anything that is irreversible. So none of our patients have deteriorated neurologically due to stem cells. So no major adverse events. Now, there are some minor reversible side effects, the most significant of which is epilepsy. But this occurs only in children who have repeated epilepsy. In other words, children who are having regular epilepsy, a couple of times a month or a couple of times a week, 3% of those children after the stem cells in the first 3 months only may have a slight increase in the epilepsy. That means a child who's having epilepsy 3 times a month, well, it may become 4 times a month in the first 3 months. In children who have not had epilepsy or whose EEG is normal, this risk is not there, it's 0. So I want to explain this. If a child has never had epilepsy, this risk does not exist. But if your child has epilepsy and the EEG is abnormal, then there is a 3% possibility. 3% means out of 100 children, 3 may have increased epilepsy for the first 3 months only. So it's a temporary thing. Well, some children have what is called a spinal headache, but this happens immediately after the treatment. It lasts for about 2 days. It's a peculiar headache which goes away on lying down. It comes only when the child sits up. It's called a spinal headache. It's because of the lumbar puncture. But it never happens when you go home. It only happens during the time you are with us, and it's completely reversible. Some kids may have a little vomit, some nausea, pain at the site of injection, etc. So basically, it's an extremely safe treatment. Now, I said I'm going to talk about stem cells, rehab, and the last part I'm going to talk about is integrative therapies. Now, this is a complete new set of therapies that actually enhance the functioning of not just the brain, but the whole body. And together, we have found that these treatments bring about the best results in our children. So these integrative therapies include the use of hyperbaric oxygen, which is called HBOT, ozone therapy, gut cleansing, acupressure, deep tissue mobilization, intravenous vitamins and micronutrients. So this is a combination of therapies that we are now using. This is at our facility. This is the hyperbaric chamber at our facility. And basically what hyperbaric oxygen does is it gives oxygen at a higher than atmospheric pressure. So it's very comfortable, it's a chamber, it's a glass chamber. The parent goes inside with the child, they lie down, there's a TV, they can watch cartoons or listen to television, and it's very, very comfortable. Most children actually enjoy this. And how does hyperbaric work? See, normally if this is our blood has got a liquid called plasma. It's got red blood cells and white blood cells and other cells called platelets, etc. Now normally you and I, we are now breathing oxygen at 1 atmospheric pressure. Okay. At 1 atmospheric pressure, only our red blood cells, and that too in the red blood cells are hemoglobin. Only the hemoglobin of our red blood cells carries oxygen. All right. Right now, what we are breathing. But when you go into the hyperbaric chamber, oxygen is given at higher than 1 atmospheric pressure. Now the oxygen goes into the liquid, into the plasma. So imagine oxygen being carried only by red blood cells, and imagine oxygen in the entire liquid of the blood. Now this oxygen goes to every little nook and corner of the brain, and it goes and oxygenates. And oxygenation is a very important part of healing damage. So we are finding that adding hyperbaric oxygen to our stem cell therapy has given us far more enhanced results. The results are more and they're also faster. It's a very safe treatment, and it's something which we believe should be used. Now there are numerous benefits of hyperbaric, from strengthening the immunity, it improves oxygenation, improves the metabolism, increases energy levels, reduces fatigue, and overall there's an improvement. The second therapy that we use is ozone therapy. So what is ozone? Ozone, oxygen is O2. Ozone is O3. So this is what we call activated oxygen. And how it works is that basically first it kills all the infections in the body, whether it's a virus or a bacteria or fungus. It reduces inflammation, reduces swelling, reduces blood clots. It's an antioxidant. So it's got a lot of positive healing effects. How is it given? Is there is this ozone chamber. You just sit over there, and oxygen goes through your whole body. You can breathe it. What you see here is Boto, where you can breathe it. It can be given through the ears. It can be given intravenously. It can be given through the rectum for gut cleansing. So basically, it also improves oxygenation through the whole body. It improves gut health, because when we give ozone per rectum, it has a very, very valuable gut cleansing effect, and we know that all our children with autism have gut issues. So giving ozone per rectum is an excellent way of improving gut health, and we've actually studied this, and we have shown how there is an improvement in the balance between good and bad bacteria by giving ozone through the rectum. And because of its anticoagulant effect, it basically improves the blood supply everywhere. So there are lots of benefits. It strengthens our immune system, kills bacteria, viruses, detoxifies our body, reduces swelling, inflammation. There's an anti-aging effect, increases the oxygenation. So lots of benefits from ozone. And this is just to show you the gut. We know that autism has a gut connection, and when we cleanse the gut through ozone, there are a lot of benefits. So we all are aware of the connection now there is between the gut and the brain directly. There's a lot of literature on it. And this is a colon hydrotherapy unit that we have at our institute. This can be used only in older children and people, but the gut can be cleansed with this. Then the next treatment is acupressure, or deep tissue mobilization, and this is specific pressure applied to specific parts of the body, and this induces a state of relaxation. We find it's very, very useful in resolving several of the behavioral issues in kids. So the muscle tension, and it has a soothing effect, improves the blood circulation. So this is something very useful. We believe in the use of high dose vitamins, so we can give intravenous vitamins. Along with vitamins, there are micronutrients like magnesium, calcium, zinc, selenium, vitamin, all the various vitamins, omega-3, glutathione. So all of these are not used. All of them can't be used in children. We selectively decide based on the investigations what is required, and we either give this orally or intravenously. So this whole combination of all these integrative therapies, the stem cell and rehab is what makes the difference. So I started with this slide and said that earlier it was only rehab. Now it is a combination. Stem cells, integrative therapy, combine it with your rehab, and we can reverse autism and cerebral palsy. We have done it. In 3,500 children with autism, we have managed to get significant improvements in the majority of them at our institute. And in almost 3,000 patients of cerebral palsy, we've been able to get similar results. So this is our institute, the Neurogen Brain and Spine Institute. And here all these therapies, all the three things we told you, they are all available under one roof. There is stem cell therapy available, there is all the rehabs, all the pictures I showed you were from our institute, and all the integrative therapies I spoke to you about, all of them are available in a single location. It's located in a beautiful, very scenic garden suburb of Mumbai that is called Navi Mumbai. It's a sea-facing facility. We've treated over 11,000 patients from 70 different countries. From all the 6 continents of this planet, from all the 6 continents, patients have come to us and we've been able to treat them satisfactorily. I'd like to acknowledge our core team, which includes Dr. Nandini and Dr. Prerna, who are our stem cell experts. Dr. Jacob is India's senior most neuro-rehabilitation expert, and we are very fortunate that he supervises the entire rehab effort. And Dr. Himangi Sane is an MD physician. She was from the United States. She herself contracted motor neuron disease. She was in America, and she was told in America that nothing can be done for you, right? She came to India, we treated her with stem cells, and she's improved significantly. That was 10 years ago, and now she works as the head of our research. So we believe a lot in quality control. So we have a lot of accreditations. We have good laboratory practice, ISO, as well as good manufacturing practice certifications. We're also certified by the European Medical Association for best medical practices. In addition, we have published 18 books. These are books written for doctors, books written for therapists. And we actually found, when we wrote initially, I wrote books for doctors and therapists, and I found that more than doctors and therapists, parents were reading our books. So then we said, well, why don't we write books for parents, because we'll make it a little easy for them to understand. And so then we have a parent guide for autism, a parent guide for cerebral palsy, a parent guide for muscular dystrophy. And all these books, hard and soft copies, are available without any cost. You can order the hard copies from us, we'll send them to you. And from our website, you can download all these books without any cost. Our work has been recognized through numerous awards, some of the most prestigious of which is the Rose of Paracelsus Award, which comes from the Socrates Nomination Committee from Oxford. This is given for pioneering research. We also have the European Award for Best Practices, which is given by the European Society for Quality Research. Again, this is given for innovative research. Our hospital received the Best Stem Cell Therapy Center at the National Healthcare Excellence Awards in 2016, and we received the same award in 2018 at the hands of the Minister of Health of India. Now, to help you make your decision, we have much more information available on our website. It's www.neurogenbsi. BSI is for Brain and Spine Institute.com. You could go there, you could email us. Our response time to your email is 30 minutes. The email is answered by a doctor, not somebody from administration. So a doctor will reply to your email within 30 minutes. You can WhatsApp, audio, video call us, or you can set up a video, Skype, Zoom meeting with myself or any of my senior colleagues. Once you've decided to do the stem cells, well, we appoint a specific coordinator who will become your single point of contact to help you with how to get here, your travel, visas, everything else. So we give you somebody who will coordinate your entire process till you come here. And I'd like to conclude by saying that the stem cell that we do, adult stem cell therapy, is a safe and effective. Please note, I said safe before effective. It is safe and effective treatment option for children on the autism spectrum, those with cerebral palsy, and for many other pediatric and adult conditions for which so far there were no treatment available. So it is definitely a clinical option which all of us should look at. So my few final suggestions at the end of my talk. My first thing is we need to accept our children the way they are and realize that they are different, not less than. This is very important, and if I could just pass this message to you, that would be the single most important message of this whole talk. See, if a child has any other medical problem, has appendicitis or chest infection or some muscle or orthopedic problem, we don't look at a child as less than. We look at a child as a normal child who has a medical problem. But when a child has a brain problem, when a child can't speak, when a child has behavioral issues, when a child has weakness, we actually believe that a child is less than, that he's not a normal child. And that thinking has to change. Our children are normal children. They are different, not less than. And what we have to do is recognize their special qualities. All these children, especially children of autism, once they improved after stem cells, they don't just lead normal lives, they excel. I've got children who could not speak now who are speaking in 8 languages. I've got children who set up chemical factories and have become millionaires. I've got, you saw the video of the kid taking, special education. We've got children who excel in things that are inconceivable for us. So we need to recognize their special qualities. So I'm going to repeat this. Our children are different, not less than. You should consult, the second point, you should consult your local doctors to come to a diagnosis and for other medical advice, because our children do need other medical help. Please find out the best rehabilitation in your city and town and give them comprehensive rehab. Children with autism need a combination of occupational therapy, behavioral therapy, speech therapy, special education. They need all of that together. So it's very important that they get comprehensive rehab. Right. Now, the family has a very important role. So it is, the family needs to have a structured and a scheduled life. That means everything should be timed. These kids work best to a schedule, a fixed time for waking up, a fixed time for play, a fixed time for study, a fixed time to watch TV, we have to give them fixed time, the fixed time when they go to school. And when the whole family's life is structured, these children tend to do very well. Also, both parents. Now, if you note, I've emphasized both. And here my message is to the fathers, because what happens is most mothers give their whole life to the child 24/7. Many mothers have given up their jobs. They're looking after their special needs child. The fathers are busy at work, and naturally so. You have to make a living, you have to support the family, you've got to pay for the medical treatments and the rehab and all of that, and so you're at work. But one of the things we found very interestingly, that in all our children who have improved phenomenally and who are now not just normal but excelling, the fathers were actively engaged in the rehabilitation process, and they were engaged in their developments later. It is very important for the fathers to be involved and to give your child a fixed time. You schedule a fixed 2 or 3 hours in a day and give that child, because the majority of autism kids are boys, and these boys look up to their father for behavior. So the father's time, we give our children everything. The one thing we don't give them is time. And here's a very simple request. If you could just give them your time in a structured format, you will see amazing improvements. You need to use supplemental treatments, like I said, whether it's vitamins or whether it's various nutritional supplements, whatever it is. If you can find good medical people advising that, please take all the supplements, omega-3, camel milk, all of that. They're all helpful, ketogenic diet and things. Please consider stem cell therapy, because stem cell therapy repairs the fundamental damage in the brain, and it makes all the other treatments. I spoke of rehab, I spoke of supplemental treatments, integrative therapies. Once you repair the damage in the brain, all these other treatments work better. So please consider stem cell therapy. But you should go to a center which has a track record of safety and efficacy, and who have published their work in scientific journals. So whenever you want to consider stem cell therapy, you go to any doctor, hospital, the first question you should ask them is your work published in scientific medical journals? Because this is so important, that the work that is done is peer reviewed. So please combine integrative therapies. Things like hyperbaric oxygen, HBOT, etc. are available. Most places have HBOT. In fact, I now believe that you can even get soft SBOT chambers at home. We have many parents who actually buy these soft chambers and give out their children hyperbaric oxygen at home. And they're not very expensive, surprisingly. The pressure in them is less. See, our normal atmospheric pressure is 1. We have what is called heart chamber. There we give a pressure of between 1.8 to 2. The ones you get at home have a pressure of 1.3 to 1.4. But it's better than not having hyperbaric, so you could consider just buying a chamber at home, do the other integrative therapies as are available. Please do your own research. Do not go by what you see, hear, read in the media, social media. Do your own due diligence and research. This is our children's life we are talking about. So it's very, very important that you do your own research and verify the safety, track record, check for patient testimonials, and only then you go to that stem cell therapy center or any other treatment center. And you have to believe first that autism, CP, intellectual disability can be treated and reversed, because unless you believe it, this is not going to work. So you have to believe that these can be treated and potentially reversed. And earlier I had shown you a clip of our Prime Minister, respected Shri Narendra Modi, who spoke about stem cells in the Indian Parliament. The world's two biggest democracies are India and America. Now let's listen to what President Barack Obama had to say about stem cells. So here you are, the world's two biggest democracies, and you have the President of India, the Prime Minister of India and the President of America both talking about stem cells. So I'd like to end my talk with this short little video of President Obama talking about stem cells.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So with that, I'd like to thank you for your attention. We are available at this email and on this telephone number. And if there are any further questions you have, please feel free to reach us. We'd be very happy to help you. Through this, you can actually set up a virtual video consult with us, which is done without any cost. So if you have any further questions, please contact this number and request for a video consult. We'd be happy to listen to what are the issues with your child and advise you the best, the safest possible treatments for your child. Thank you for your attention.